First, this past weekend's mass shooting put the spotlight on the life or death work that's done inside our area trauma centers. News 10 NBC's Declan Stablo spoke with a trauma surgeon about what goes into saving lives following a mass casualty. He joins us live from Strong Memorial Hospital. Certainly, we know, Declan, that responding to mass casualty events like this, it's not just reacting, but it's also really good preparation, right?
Exactly. Dr. Mark Gestring, Chief of Trauma and Emergency General Surgery here at Strong Memorial Hospital, says whenever an event like this happens, they try to learn something so that they're ready for the next one. Dr. Gestring says that one thing hospitals across the country are learning is that events like this are becoming more common.
On a quiet afternoon when you're sitting and planning what new type of disaster could occur, maybe you feel like maybe a doomsday predictor, but if you're not thinking about the kinds of situations you get into, then you're not going to be prepared for what actually happens.
Dr. Gestring says being prepared means ensuring on-call doctors are available immediately and knowing who needs to be called in. Once patients arrive, they immediately figure out a plan for care.
When patients arrive here, sorting out who is seriously injured and maybe who can wait. Of the seriously injured, who needs emergent surgery, because we have operating rooms here that are open 24/7. So who needs emergency surgery, those people would probably go first.
Dr. Gestring also spoke about the importance of having a system to keep things organized once patients arrive.
You would think the clerical part maybe is not so important, but making sure that you're patient number 1 and you're patient number 2 and you're patient number 3, and making sure that the blood that's destined for you and the x-rays you're getting, all those things are kept together, becomes confusing when you have multiple patients at once, all with similar injuries.
Because this happened close to the hospital, Dr. Gestring says there wasn't much time to prepare.
So we don't have quite as much preparation time, but the systems that we have in place allow us to ramp up very quickly and to make the space we need very quickly for those types of situations.
As for what it's like for doctors in these situations,
if you're a professional at what you do, it shouldn't affect you at the beginning. It might affect you afterwards, but at the beginning, it's like if you're a firefighter, you're going to put out a church fire, same as you're going to put out a house fire, right? You don't think about it.
Dr. Gestring is proud that Strong can help in those situations, but sometimes life-saving care happens at the scene. Coming up at 6, you'll hear about the role law enforcement plays during these emergencies. Live outside Strong Memorial Hospital, Declan Stablo, News 10 NBC.
Declan, thank you so much. Now, the other closest Level 1 trauma centers are in Buffalo and Syracuse. Dr. Gestring says that the hospital fully supports the city's crime prevention efforts.